The sex of the baby can usually be determined by an ultrasound scan at 18 to 20 weeks of gestation. However, there are other methods to determine the sex with certainty. 1. Ultrasound scan, the most common method. A routine ultrasound scan, usually performed between 18 to 20 weeks, can determine the sex of the baby. However, due to the position of the baby and other factors, in some cases the sex may not be clearly determined. 2. Blood test. NIPT, non-invasive prenatal testing. This test can be performed as early as the 10th week of pregnancy and allows the sex of the baby to be determined by examining the genetic material in the expectant mother's blood. This test can also determine the risk of certain genetic diseases. 3. Amniocentesis or CVS. These are genetic tests and are usually performed in high-risk pregnancies to identify health problems related to chromosomes as well as gender. However, because these tests are invasive, they are usually only performed when absolutely necessary. As a result, the sex of the baby can be most clearly determined by ultrasound between 18 and 20 weeks.